Hi there, welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy talking about all kinds of things. And we talked about breast aug in the last section. So now we're talking about liposuction. Good. Let's talk about the different liposuctions. You said there's a lot. Tell us what they are.
There's different ways to do liposuction. Probably the most often used is still the tumescent technique, where fluid is put in. That helps decrease bruising, helps you feel better afterwards, and decreases the amount of oozing because it puts a little pressure in there so that we get a nice smooth result.
So the old way is still the best way. Is that what you're saying?
Still the best way.
Yeah.
There are people adding ultrasound, adding lasers, different techniques.
Yeah.
They add more energy. So unless there's a real benefit to them, they are also giving you more risk.
Oh, okay. Gotcha.
So most of the time I'm using tumescent technique.
With the cannula and you just same old way.
Works very well.
Have the cannulas gotten smaller or does that
Cannulas have gotten smaller through the years, though I'd say over the last 10 years we're all using fairly small cannulas. It lets things change more gradually, keeps us from doing too much in one spot.
Gotcha.
And I think overall gives a better result.
All right, well, let's take a look at those results, shall we? We've got a lot of liposuction pictures. First one.
Okay, so this is a real common area. There's love handle,
love handles.
Lower back, the sides.
Muffin tops, they call them
Muffin tops, yeah, we don't like those.
No.
So usually with this case, I'll make a small incision right like in the fold of the buttock, right at the top. And I can sneak to both sides. If it goes more on the side, then sometimes I'll make a couple other small incisions, but they tend to be like 1/4 of an inch, 3/8 of an inch in width.
It's fantastic, you can't even tell. And you did it I mean, it's not a huge difference, but it's just enough to make that shape.
Yeah, so we want to just get rid of that stubborn fat because that just won't go away. She's in otherwise good shape. And sometimes we'll take that fat and put it a little bit lower. We'll put it into the butt.
You can put it in the butt.
To make
a little Brazilian
bigger.
butt lift. I like that. Because why not use your own fat?
Why not?
Next pick.
So another place that's real popular is the neck.
Oh, yes.
I think the neck is a place that's a little harder because there's so many other issues going on there.
Right.
So in this case, there's some fat, but she also has a small chin.
Oh, so what'd you do?
So in this case, I used a chin implant. In addition to doing liposuction, that gives us a little more definition of the neck. Because they relate to each other.
They do. That is beautiful. I love that. That's a great outcome. And no scar. I can't see any scar. Next
the scar is
picture
underneath the chin. So this is just liposuction.
Oh, okay. That's just liposuction.
I mean, the
on the
ideal
chin.
patient would have a little more fat there before,
right.
So there's a little more of a change. But he had enough good elasticity that I can take that stuffing out and the skin will shrink up to where it belongs.
Beautiful.
I think the liposuction techniques themselves don't cause as much shrinkage as we think they do. It's really intrinsic in the skin. It's the springs in the skin.
It's how your skin is. Basically genetics, right?
Yeah, it makes a huge difference.
We're still waiting for that skin tightening laser.
I'm still waiting.
Next
so here,
picture.
Okay, liposuction would probably not help here. It would probably just make it more deflated and let things drop. So in this case, I've done a neck lift or facelift along with some liposuction to get rid of the extra fat that's there. That takes care of both problems.
That really
the stuffing and the laxity of the skin.
What's your recovery period on liposuction and, say, a lower facelift?
So liposuction, probably again a week because we're waiting for bruising, swelling to go away. Final result we don't see for a few months, but usually by a week or two it looks good. With a facelift, neck lift, there's more bruising, a little more recovery, and it may take 2 to 3 weeks.
All right, not bad at all.
Liposuction, again, this is sort of a little bit everywhere. So this isn't someone with one area that's big. Again, that's the ideal patient, has one area that's big.
Really?
We just make it match and everything looks great.
So here I've taken
a little bit everywhere.
Gotcha.
And they've done their work. I mean, they diet, they exercise, they don't have extra skin. It's really a matter of just removing the extra stuff.
And you're sick of wearing Spanx. And you're going, I'm going to go see Dr. Mealy. I'm sick of it. I hear you. I get them. All right, next picture.
And the same thing here. So sometimes the muscle is loose. We have to do a tummy tuck. In this case, it was just disproportionate fat.
Oh, okay.
So
and
fat
it came right back.
Lower belly.
That looks amazing.
So when we get rid of that, it's pretty smooth underneath.
That's very nice. And scars on that?
And again, the recovery for this is a week. A tummy tuck, it can be 2 to 3 weeks sometimes if it's real sore.
Oh, absolutely.
So if we can get away with less, I'm happy to do less, and as long as I can get a good result.
And the scars, nothing on this, pretty much.
And the scar is a very small scar. Yeah,
whereas a tummy tuck would be a lot longer.
Tummy tuck usually from hip to hip.
Next pick, here we go.
Same thing here again, disproportionate fat, lower abdomen.
That's great.
And that will work.
Did you
but I do have people that come in, they have that same shape and their muscles loose. It's like, I can't do lipo for them. So you have to go to someone who has some experience and can pick out the best procedure for you.
Did you do a Brazilian butt lift on this woman? Did you put just a little fat in her buttock area?
I think actually I may have done that.
That looks quite nice. All right. All right, one last pick here.
So this is a guy. So for men, a lot of times we'll have a little extra fat in the chest, and we don't like having bigger chests unless it's all muscle.
Yeah.
So in this case, just liposuction really makes a huge difference in contour if there's fat causing it. If there's glandular tissue there, then sometimes I need to make an incision and take out some of the glandular tissue. Okay. But in this case, it's just lipo, so the shrinkage around the nipple, the areola, is just because there's less stuffing.
Now, is it all general anesthesia on liposuction, or
usually I do it under general anesthesia?
Okay, everything. And then do you have to wear a garment after for a?
Yeah, I have people wear a garment for 2 weeks, usually day and night, and then half the time for another 4.
fantastic. Those are great pictures.
Thanks.
All right.
It's a great job. I like what I get to do.
I know, you have a fun gig. Let's switch once in a while and see if I can do it. All right, for more information about Dr. Mealy, you can call 925-943-6353. Check him out on the web, drmealy.com or sanfranciscobreast.com. All right, we got lots more. Keep it right here on Body Beautiful. We'll be right back.